Welcome. Today's lesson is how to improve Alzheimer's sleep quality and reduce sleep disturbances. Sleep disturbances are so common among Alzheimer's patients and other types of dementia, and it affects not only their quality of life, but also the well being of their caregivers. But what if there was a way to improve Alzheimer's sleep quality and reduce disturbances for those living with dementia without relying solely on medications? In this audiocast, we'll explore the causes of sleep disturbances in Alzheimer's dementia patients, common sleep disorders, and practical non pharmacological strategies to create a better night's sleep for both patients and caregivers alike. I really like to take the non-drug approach to providing a good night's sleep for myself, for my patients, and for my caregivers, my family caregivers that I deal with. In summary, we're going to understand the causes of sleep disturbances in Alzheimer's patients and other dementias. Another thing we're going to learn is to create a consistent sleep routine and optimize the environment to improve quality, and then seek professional help and memory care services for managing symptoms at times. So let's understand Alzheimer's sleep disturbances. Sleep disturbances in Alzheimer patients and other dementia patients as well has a multifaceted issue that can stem from various factors. For instance, disrupted circadian rhythms can lead to confusion between night and day, making it difficult for patients to fall asleep and stay asleep. One such sleep disturbance can be attributed to medications used to treat dementia, which can have many side effects that disrupt sleep, such as nighttime stimulation and dream disturbances. Additionally, different types of dementia, like Lewy body dementia and Parkinson's disease dementia, can cause unique sleep issues. By understanding the root causes of sleep disturbances, we can devise effective interventions to address them and improve the overall health of individuals living with dementia. So let's talk about the disrupted circadian rhythms. The circadian rhythm is a 24-hour cycle that governs our sleep-wake cycle. So it can be disrupted in Alzheimer's patients and patients with other types of dementia, especially Lewy body and the Parkinson's disease dementia. This disruption can lead to confusion between day and night, resulting in difficulty falling asleep, staying asleep, and increased nighttime wandering. Additionally, these disruptions may affect slow wave sleep, which is an essential part of the sleep process. When Alzheimer's dementia patients or other types of dementia patients struggle to distinguish between day and night, their sleep quality suffers, leading to further sleep disturbances and potential health complications. So let's talk about the medication impact on sleep. While medications play a crucial role in managing dementia symptoms, some can negatively impact a sleep quality. For example, certain medications related to chronic alcohol use, depression, or sleep apnea may adversely affect sleep. It is essential to evaluate and adjust medications as needed to minimize sleep disturbances in Alzheimer's dementia patients and other types of dementia patients. A tool like the Sleep Disorders Inventory can be useful in assessing sleep symptoms during the initial evaluation and monitoring the efficacy of treatment interventions. This is a tool used by sleep disorder specialists to determine causes of your sleep disorder. So let's talk about specific types of dementia and sleep issues. Certain types of dementia, such as Lewy body dementia and Parkinson's disease dementia, can cause unique sleep issues. One example is REM sleep behavior disorder, also called RBD. And this is a sleep disorder characterized by repeated episodes of vocalization, meaning talking or noises and complex movements during sleep. RBD has been established as an early warning sign of Parkinson's disease, dementia with Lewy bodies, and multiple system atrophy, all classified as synucleinopathies. And I can tell you, I have had many partners of individuals that had Lewy body dementia or Parkinson's disease, sleep with people that have pushed them out of bed or screamed or had terrible movements. They ended up sleeping in the other bed because they couldn't sleep with an individual. And this is prior to diagnosis of diseases. It is essential to recognize and address these unique sleep issues to provide targeted care for individuals with specific types of dementia. So let's talk about identifying common sleep disorders in Alzheimer's patients or other types of dementia patients. In addition to dementia sleep disturbances, Alzheimer's patients who are dealing with Alzheimer's disease are also at a risk for common sleep disorders like sleep apnea, restless leg syndrome, and REM sleep behavior disorder. These sleep disorders can contribute to sleep disturbances and poor sleep quality, further exacerbating cognitive decline and impacting overall health. By identifying and addressing these sleep disorders, we can provide a more comprehensive approach to improving sleep quality for Alzheimer's patients and others suffering from different types of dementia. So let's talk about sleep apnea. Sleep apnea is a form of sleep disordered breathing, and it is characterized by intermittent pauses in breathing during sleep, often resulting in loud snoring and shallow breathing. Studies estimate that the prevalence of obstructive sleep apnea among dementia patients residing in long term care facilities is as high as 70 and 80%. And as a nurse who has worked in nursing homes, I can tell you that is probably accurate. And the majority of them are not wearing any kind of sleep apnea type of apparatus. If left untreated, sleep apnea can exacerbate cognitive deterioration and negatively impact the overall health in Alzheimer's patients as well as other types of dementia patients. And I know many people are out there, my family caregivers, that are caring for family members, don't wanna wear the BiPAP, the CPAP, or whatever machines they're, referred to wear to sleep because they don't like the way they feel, they get it well, if they interfere with their getting comfortable during sleep, but it does cause an exacerbation of cognitive decline, and it's definitely something that people need to be aware of. Let's talk about restless leg syndrome. Restless leg syndrome, or RLS, is a neurological disorder that causes an irresistible urge to move the legs, most accompanied by uncomfortable such sensations such as pulling, creeping, or tugging. This disorder can lead to difficulty falling asleep and staying asleep, further contributing to sleep disturbances in Alzheimer's patients and other types of dementia disorders. Proper identification and management of RLS can alleviate discomfort and improve quality of sleep. So let's talk about REM sleep behavior disorder. REM sleep behavior disorder, known as RBD, is another sleep disorder commonly observed in Alzheimer's patients and other types of dementia patients. RBD is characterized by the manifestation of dream enacting behaviors during REM sleep, which may include loud talking, shouting, and physical movements. And if you've ever observed anybody that has RBD, they are challenging when you when they sleep. They do loud talking, they shout, and the physical movements, if you're sleeping with them, can cause black eyes or to get pushed out of bed. RBD has been linked to neurodegenerative diseases such as Parkinson's disease, dementia with Lewy bodies, and multiple system atrophy. Proper management of RBD is crucial to ensure patient safety and improve sleep quality. So let's talk about the non-pharmacological strategies for improving sleep in Alzheimer's patients or in other types of dementia. Non-pharmacological strategies, that means not using medications or drugs, can play a significant role in improving quality of life in Alzheimer's patients and other types of dementia without relying on medications. These strategies may include establishing a sleep routine, optimizing the sleep environment, and using relaxation techniques. Implementing these non-drug therapies can help create a better night's rest for both patients and caregivers, reducing stress and potentially slowing cognitive deterioration. So let's talk about establishing a sleep routine. Creating a consistent sleep routine with regular bedtimes and morning rituals can help regulate the sleep-wake cycle and improve sleep quality in Alzheimer's patients and other types of dementias. Incorporating activities such as reading or listening to calming music or taking a warm bath before bedtime can help relax the body and mind, preparing the patient for sleep. Consistency is key, as adhering to sleep routines help establish a healthy sleep-wake cycle and enhance sleep quality by maintaining regular sleep patterns. So let's talk about optimizing the sleep environment. Adjusting the sleep environment can also help create a more conducive atmosphere for sleep in Alzheimer's patients and other dementia patients as well. This may include ensuring a dark, quiet, and cool atmosphere free of distractions and electronics. Additionally, exposure to bright light therapy in the morning or throughout the day can lead to increased total nighttime sleep in individuals with dementia residing in nursing facilities. I always encourage my patients, my family caregivers, and my patients to actually sit in the sun every day for a little bit. And if you don't have it, get those LED light boxes and expose yourself to sunlight during the day so that you can have your circadian rhythms can get into the sleep wake cycle. By optimizing the sleep environment, we can help Alzheimer's patients and other types of dementia achieve better quality of sleep. Hey, and when they sleep, the caregiver sleeps too. And that's important. Let's talk about relaxation techniques. Relaxation techniques such as deep breathing exercises, soft music, and aromatherapy can help Alzheimer's patients and other types of dementia patients unwind and fall asleep more easily. By practicing these techniques, individuals with dementia can achieve better sleep quality and reduce stress and anxiety levels. It's important to note that these techniques require practice to be effective, so incorporating them into the daily routine can help maximize their benefits. One of the sleeping techniques and relaxation techniques I use, and I encourage my family caregivers to use, is essential oils. And I recommend that when you want someone to rest, you spritz their pillows with lavender because it has a calming and a sleep-inducing effect. And I recommend that you maybe spritz their pajamas that they're wearing with some from lavender, or give them a calming, relaxing massage therapy, hand massage with lavender, and it can help as well. Or giving them a massage of their shoulders and back with the scent of lavender is also very effective in helping relax a person and encourage sleep. So let's talk about managing daytime sleepiness and napping. This is a struggle. This one really is. Managing daytime sleepiness and napping is crucial for maintaining a healthy sleep wake cycle in Alzheimer's patients and other types of dementia as well. Excessive daytime sleepiness can disrupt nighttime sleep and lead to further sleep disturbances. By understanding the causes of excessive daytime sleepiness and balancing naps with nighttime sleep, we can help dementia patients and Alzheimer's patients as well achieve a more restful and restorative sleep pattern. So, what are causes of excessive daytime sleepiness? Excessive daytime sleepiness in Alzheimer's patient can be attributed to various factors, including medication side effects, sleep disorders, sleep deprivation, and poor sleep quality at night. Excessive daytime sleepiness is more commonly associated with Parkinson's disease dementia and Lewy body dementia than it is in Alzheimer's disease. Assessing the causes of daytime sleepiness can help tailor interventions and improve overall sleep quality. So, balancing naps and nighttime sleep. Balancing naps and nighttime sleepiness is essential for all types of dementia patients, including Alzheimer's patients, because as long as daytime naps can disrupt the sleep wake cycle and lead to nighttime wakefulness. To reduce daytime naps, promoting physical activity and creating a peaceful environment for nighttime sleep can be helpful. Establishing a consistent bedtime routine can also aid in facilitating relaxation and improving sleep quality. So, when to consider sleep aids in medical intervention? Sleep aids and medical interventions such as melatonin supplements should be considered for Alzheimer's patients and other types of dementia patients only after non-drug therapies have been exhausted and are under medical supervision. Sleep-inducing medications should be used sparingly due to the risk of increased confusion, sedation, and falls in dementia patients. Absolutely, sleep medications increase the risk of falls in dementia patients. So, by carefully evaluating the need for sleep aids and medical interventions, we can ensure the safest and most effective approach to improving sleep quality in any type of dementia patient, as well as the Alzheimer's patients. So, let's talk about melatonin supplements. Melatonin supplements combined with bright light therapy may improve sleep quality in dementia patients, but should be used with caution and under medical supervision. Melatonin is a hormone that regulates sleep-wake cycles and can be used to treat sleep disorders, jet lag, and anxiety before and after surgery. However, melatonin supplements may result in side effects such as headaches, dizziness, and nausea. Consulting a doctor before taking melatonin supplements is crucial to ensure safety and effective use. Now, let's talk about medical supervision and sleep aids. The importance of medical supervision when using sleep aids in dementia patients cannot be overstated. Sleep aids should be closely monitored by the family caregiver and healthcare professionals to observe for indications of abuse or misdirection of scheduled medications prescribed to treat insomnia and other sleep disorders. Consulting a sleep medicine specialist can determine the most suitable course of treatment for sleep disturbances in patients that suffer from any type of dementia. Caregiver support and resources for managing sleep disturbances. Caregiver support and resources are essential for managing sleep disturbances in all types of dementia patients. As caregivers play a crucial role in implementing sleep strategies and monitoring patient progress, their well-being and ability to access support are vital to the successful management of sleep disturbances. Caregivers can benefit from various resources, such as support groups, online resources, and respite care to assist in managing sleep disorders in dementia patients, even and including Alzheimer's patients. Caregiver self-care. Self-care is vital for caregivers of dementia patients, as sleep disturbances can be challenging to manage. By prioritizing their own well being, caregivers can better support their loved ones and provide optimal care. Strategies for caregiver self care may include ensuring adequate sleep, maintaining a nutritious diet, engaging in regular physical activity, and taking periodic respites from caregiving responsibilities and seeking assistance from loved ones and friends. I'm going to tell you here that in Caregiver Relief, we have the Stress Buster course, which provides lots of information and strategies for self care and stress management. And I encourage you to check it out. The Stress Buster course at www.caregiverrelief.com. So let's talk about professional help and memory care. As dementia progresses, professional help and memory care may become necessary to provide additional support for managing sleep problems and other dementia related symptoms. Memory care can assist in abating confusion and disorientation, which can result in sleep disturbances and enhanced communication and social interaction which can help diminish stress and anxiety. When it becomes challenging to adequately manage the patient's sleep issues and dementia symptoms in a home setting, seeking professional help and memory care services for people with dementia can provide much needed support and resources. And I'm going to tell you that one of the things that I'm hoping to see grow in the future, because we have a public health crisis here, we have a shortage of dementia care workers, we have a shortage of direct care workers, and we have limited resources available for respite. I'm hoping that people will start to open up nighttime care programs for people that have dementia, and they can go into instead of adult daycare, it would be adult night care, and it would provide activities and a calming environment to help those that need sleep get the sleep by the family caregivers by dropping off their family member to a nighttime care program. If you're looking for a business, that's a big one. So, in conclusion, sleep disturbances in dementia patients can significantly impact their quality of life and the well being of their caregivers. By understanding the causes of sleep disturbances, identifying common sleep disorders, and implementing non pharmacological strategies, we can help improve sleep quality for both dementia patients and their caregivers. Caregiver support and resources are essential for managing sleep disturbances, and professional help and memory care may become necessary as Alzheimer's progresses or dementia progresses. With proper care and intervention, we can create a better night's rest for those living with dementia and their loved ones. So I want to address some frequently asked questions. How does dementia affect your sleep? People living with Alzheimer's or other types of dementia often experience sleep disruption to their sleep, including difficulty falling asleep, frequent nighttime awakenings, sleep fragmentation, and excessive daytime sleepiness. Reduced levels of melatonin, damage to the body clock, our circadian rhythm, changes in brain activity, and disturbances such as nocturnal wandering can all contribute to disrupted sleep. I'm frequently asked, at what stage of dementia or Alzheimer's is sundowning occurring? Sundowning is a distressing symptom that affects people in mid to late stage Alzheimer's and other forms of dementia. It can start as early as the middle stages and worsen as the condition progresses until it tapers off towards the end and as our family members move into the later stages of dementia. So I'm frequently asked, is there a good sleeping pill for dementia patients? Balsamra is a sleeping pill for dementia patients that has been recently approved by the FDA, and it inhibits the activity of orexin, a neurotransmitter involved in the sleep-wake cycle. Melatonin may also be prescribed, but this may worsen other dementia symptoms and leave the person feeling drowsy during the day. So, what are some non pharmacological strategies for improving sleep in dementia patients? Establishing a sleep routine, optimizing the sleep environment, and using relaxation techniques are all effective non pharmacological strategies to improve sleep in Alzheimer's patients. These strategies can help reduce the amount of time it takes to fall asleep, increase the amount of time spent in deep sleep, and improve overall sleep quality. It is important to note that these strategies should be tailored to the individual patient's need. Another question I'm asked is, how can disrupted circadian rhythms affect sleep quality in dementia patients? Disruption of the circadian rhythm caused by dementia disease can lead to difficulty falling asleep, staying asleep, increased nighttime wandering, and greatly affect sleep quality. These disruptions can significantly impact the quality of life for those affected by dementia, as well as their caregivers. Poor sleep can lead to increased fatigue, irritability, difficulty concentrating, all of which can further complicate the challenges of dementia, caring for somebody with dementia. This has been brought to you by caregiverrelief.com. I'm Diane Carbo, RN.
Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.